Good evening. Thank you all so much for being here. We wanted to make certain that the governor was able to complete his press avail prior to moving forward and coming out to update you. But we also and always appreciate you being here. This evening, as you can see, we are joined by our public safety and public health officials, including our Sheriff Marlon Guzman, along with, of course, Chief Ferguson, Chief McConnell, Chief Samaran, Director Morris, and city council members who are joining us, and we do appreciate that. We are here really to brief everyone today as it relates to three specific goals. One, to update you and our residents about the recent developments, to give you a sense of how we will manage our public avail and public messaging going forward from this day on, and explain really the next steps as it relates to our collective and unified response. As of this morning, as you can imagine, we have been in multiple briefings, whether it's with the governor, of course, of the state of Louisiana, John Bell Edwards, with our college and university chancellors, as well as presidents, of course, speaking with our primary school associations, whether that is the New Orleans Public School, OPSB, as well as the Archdiocese and our independent school associations. We know that since last night and what was recently confirmed by our governor, that there are an announced 7 more presumptive positive cases, bringing us up to a total of 13 statewide, with of course the majority being in Orleans Parish. We knew that that number would grow, and we do expect it to grow even further. Earlier this evening, as you were made aware of, the governor did issue a state of an emergency relative to this outbreak, and tonight I've actually done the same for Orleans Parish. We have officially declared a state of emergency. As you know, that unlocks additional resources for our city to respond and continue to be as proactive as possible. We have been preparing to respond, and we're doing everything within our power to do so, and doing it in a calm manner, but very much unified, organized, and absolutely professional. We will and continue to hold steady on the public events that were canceled for the weekend, and also we have seen that additional private events have been canceled as well, and we're encouraging the public really to take heed to the events that have been canceled publicly, and just be aware of private events and ways that they can minimize any access to or transmittal of this particular virus. I am pleased to see that my colleague, Madam Mayor, Cynthia Lee Shang in Jefferson Parish, has also followed suit. And we do appreciate that, because at the end of the day, we really are all in this together. And we collectively represent the metro area of Orleans, and really the metro area collectively. As I mentioned, we are encouraging producers of private events to act accordingly and to be mindful of our declaration of the state of emergency. I do want to make it clear, as mayor, I have the authority to cancel public permitted events, but not private ones. Our public health and safety team are doing everything that we expect them to do, of course, and now I'm asking the media as well as the general public to join us in that regard and do everything that you can do as well. That means paying attention to public safety guidelines. That really means being mindful of the vulnerable residents within our community. We are continuing to reach out to our nursing homes and, of course, our senior living facilities. A lot of times the senior living facilities kind of get left out of the conversation, but understand they are in no way left out of the outreach of the city of New Orleans, and through our Office of Homeland Security, we've issued guidelines, state guidelines to these senior living facilities as well. with specific guidance from our public health leaders. As I stated, we are absolutely in this together, and now more than ever. I want to thank all of our residents and organizations for their patience, for their vigilance during this time, and we all can agree this is absolutely a challenging time. On that note, I would also like to thank our local, state, and federal partners. That means, of course, the governor of the state of Louisiana, our business leaders, neighborhood leaders, and faith leaders that we will continue to do outreach to. I want to specifically thank our congressional delegation. You know, I called on them this morning as relates to specifically Congressman Richmond, Congressman Steve Scalise, Congressman Graves. I asked them to kind of double down on a request that I made to the Louisiana Department of Health that then went to CDC for technical assistance for Orleans Parish. I directly contacted our delegation because I wanted to make sure that we did not only get our requests to the federal level, but we received the response that we wanted. And I'm happy to say and pleased that we will and we have been granted the response and results from that request, and we will receive 2 individuals coming from the federal government, CDC, here in the city of New Orleans on tomorrow. We've also been provided support by Colonel Bailey of the Louisiana National Guard. Additional supportive services will be granted to our EOC that started today and will increase on tomorrow. Colin will speak more on the EOC. We're in 24-hour activation, and you'll learn more about that after me. I'm gonna, you know how I do, I interject as we move along. This situation continues to be fluid. As I said, even flexible is just too rigid, so we're gonna stay at the, along the battle rhythm that we've created several days ago. Our administration will be updating the media every single day with information available online and also via press releases. Every time that may be an increase of a particular case, that doesn't mean that we're going to go ahead and have an avail. So we will address you as we see necessary, depending on how things shift. Again, this is very, very fluid. We have learned from the many previous emergencies that we faced in the city of New Orleans that not only that we have to be unified, and we are, but we know how to stay focused. We know what the mission is, and at the end of the day, that is the public safety of our residents as well as the visitors of the city of New Orleans. I want to encourage the public to stay tuned for real-time information. I gave you this multiple times. We'll continue to give it to you because it's just that important. Text COVID-19 to 888-777 to receive alerts again in real time. You can visit NOLA or ready.nola.gov for again up-to-date information, and follow us again on social media. I'm now going to turn it over to Dr. Jennifer Avegno, who has been our lead and point as the Director of Health for the City of New Orleans. Dr. Avegno?
Thank you, Mayor. Thanks, everyone. As Mayor Cantrell said, this is a fluid situation. You heard the governor just announce that we now have a total of 13 presumptive positive cases, and also announced that 3 of those presumptive positive cases reside at Lambeth House here in the city. Since last night, we have been in constant contact with their administrators and are aware that they have taken a number of steps to prevent any further spread in the facility, including canceling social events, limiting facilities, closing their cafe and wellness center, checking their staff. The New Orleans Health Department is working with the Louisiana Department of Health to do contact tracing in this case and in the cases to follow. We have issued guidance in conjunction with Louisiana Nursing Home Association that went out to all nursing homes in Orleans as well as our assisted living senior facilities. This guidance is very thorough and recommends limiting visitors, temperature checks, and increased cleaning procedures. It will be available on our website as well. This guidance is based on a thorough review of lessons learned in Washington State. their directives there and on new guidance from the CDC. As our presumptive positive cases continue to rise, I cannot stress enough that we have to focus on our community members who are at the greatest risk for serious illness. This includes our elderly residents and those who have chronic medical conditions such as heart disease, lung disease, or cancer. We are asking these community members to take extra precautions, to reconsider travel, and to limit their exposure to large gatherings. We are asking everyone do their part to help protect these vulnerable community members. We know that they are disproportionately affected by this disease, and we can all take care of our community. That includes preventing the further spread of disease, what we've said over and over and over again. Wash your hands regularly, stay home when you're sick, cover your cough. Take the next step to stay in touch with the elderly parent or grandparent or neighbor. Make sure they need help, and if they need help, give it to them in your capacity. Please be mindful of contact with elderly people and those with chronic medical conditions. Do your best to practice what we call social distancing and stay 6 feet away and avoid touching. We ask the public as well to please reserve 911 for life-threatening illness only. As I believe you heard the governor say, starting tonight, 211 will be available to take questions and concerns of the healthy public, those who are not ill, about this disease and about their potential concerns, so we would encourage you to do that. As Mayor Cantrell has said, the decision to cancel this week's parades and second lines at events was made yesterday and is part of a set of public health social distancing measures that are aimed to slow the rate at which COVID-19 spreads in our community. We know that COVID-19 spreads between people in close contact with each other, approximately 6 feet. While there is no absolute number of people that is safe for an event, large events like parades and second lines are sites of close and potentially extended contact. They are also very difficult to do contact tracing. So if we do see a new case, it will be very difficult to find out who that individual stood next to at a parade, for example. Bottom line is that social distancing measures are best practice. They're being used all over the country. They are a proven public health tactic that can slow the rate of disease spread, limiting the impact not only on our healthcare system, but protecting our most vulnerable community members. Please understand that all the decisions that we make are not made lightly. In New Orleans, our cultural traditions are the backbone of our community, and in the coming weeks, as this develops, we will need to be creative about balancing our social lives and the health of our community, which is paramount to us. We really appreciate your attention during this very fluid and rapidly changing situation. Thank you.
Thank you, Dr. Bagno. Thank you very much. And we're going to keep it going. I'm going to ask our Director of Homeland Security, Colin Arnold, to update you at this time. Colin?
Thank you, Mayor. Good evening, everyone. Today, the governor declared a public health emergency, and as the mayor mentioned, she followed suit with a local emergency declaration. This emergency declaration at the local level provides a framework in which the city can request additional resources from the state and federal government. As you've seen, we've already been leaning forward and proactive in making that happen, with CDC technical assistance arriving tomorrow. Today, the Office of Homeland Security and Emergency Preparedness activated the city's Emergency Operations Center. Their public safety and public health liaisons primarily are coordinating the city's response to the ongoing COVID-19 situation. We're working closely with our partners at the local, regional, state, and federal level, and with the Information Center to provide timely, accurate, and consistent information to the public through our NOLA Ready platform. We continue to work with the administration to assist public safety agencies and all departments to take the necessary precautions to prevent the spread of COVID-19. Our public safety agencies and departments are taking the necessary precautions and have the necessary personal protective equipment, what we call PPE. At this point, we have enough equipment to meet the needs of the departments. However, like most agencies nationally, we anticipate needing more equipment in the near future. In late 2019, we proactively, it's on back order, which is an international demand right now and is not out of the ordinary. We will get this equipment. We're advocating the state and federal levels to access stockpile equipment as necessary as we continue to see cases locally. Citywide, we're communicating with our own employees to encourage healthy practices and are preparing leave and remote work policies for those employees that are eligible to do that. As we continue to communicate community stakeholders, healthcare providers, long-term care facilities, schools, houses of worship, and businesses, we're communicating with them to ensure that they have the most up-to-date information possible. As Jen and the mayor mentioned yesterday, we made the determination that in order to prevent the spread of this COVID-19, we will be canceling this weekend's large public events. And this is an action, again, is being taken out of an abundance of caution. Again, as you've heard, this is a rapidly evolving situation, and we'll continue to take the information we have in front of us, and we always have public safety in mind. That is our primary concern. We, my office, the health department, the administration, the New Orleans Police Department, we're all working and in regular contact with these special event coordinators, and we'll continue to work with these organizers in this ever-evolving situation. It's important that the public pays attention because this is an ever-evolving situation. Make sure you are getting information from accurate sources, including the CDC, the Louisiana Department of Health, and here in New Orleans, NOLA Ready. You can find us, as the mayor mentioned, at ready.nola.gov. You can follow us on social media at NOLA Ready. Slight correction, sorry, Mayor, it is COVID NOLA.
Oh, nice.
COVID NOLA to 888-777. Text that, put it in your phone, text COVID NOLA to 888-777, and you can get those real-time alerts that we are putting out frequently about COVID-19. Thank you.
Thank you so much, Colin, and for the clarification on that. What I do know is that it works. That's the main thing, and of course, getting it right. So with that, I'm going to also ask Sheriff Marlon Guzman to give us an update from the parish.
Thank you, Mayor.
Prison.
The Orleans Parish Sheriff's Office has a plan in place for illnesses such as the influenza, and we modified this plan to better fit COVID-19, also known as the coronavirus. Sheriff's Office has been proactive in disseminating information and taking steps to prepare our employees, contractors, visitors, volunteers, and inmates to prevent the spread of COVID-19. We are in communication and coordination with the City Department of Health, the Louisiana Department of Health, and the Center for Disease Control. Our medical department, WellPath, and our health services administrator is here, has developed a screening tool following the CDC guidelines and is currently screening all inmates at intake when they arrive. There is a protocol in place to segregate suspected cases and a process to call for testing for the virus. All confirmed cases will be routed to the hospital by specially trained OPSO security staff. Also in place is a protocol to house immunocompromised or patients with acute medical issues in a place where they can be segregated. A system is in place for tracking illness trends to ensure that the facility can deter stressors that may affect operating capacity, including staff and supply needs during a pandemic. Additionally, hand sanitation stations have been increased, educational and instructive signs are in place, and a number of general cleanings with CDC recommended cleaner has elevated. Our operational plan is flexible enough to address all scenarios and any contingencies. The safety of our staff and inmates is our top priority, and we'll continue to take the precautions necessary to make this happen.
Thank you, Sheriff.
Thank you, Mayor.
Thank you so much. I appreciate very much the New Orleans City Council in their committee meeting this morning as relates to updates, not only for them, but also for the public relative to COVID-19. At this time, I would love to ask Councilmember Moreno, which will be followed by Councilmember Palmer and Councilmember Banks. Hey, Councilman, how you doing? Good to see you. Come on up.
Thank you. Well, I would say, I guess the good news is that as you go around the city of New Orleans, you're certainly going to notice that the people are taking precautions. I mean, there is hand sanitizer everywhere, and people are always talking about washing their hands. In fact, Councilmember Banks, thank you for the hand sanitizer that you just gave.
You need some more,
In a city where we are so used to greeting each other with a hug, we're now doing this thing here, this elbow bump or fist bump. And so, so people are taking precautions, and certainly we understand that the people of the city are concerned. But I want to reassure them that this city government is truly working in a coordinated effort with state and federal leaders. And I believe that it is a role of the city council to do what we can to, of course, back up our mayor and her team, but also to make sure that we are disseminating accurate information, that we are spreading facts and not fear. And so that's what we tried to do this morning with our committee meeting, and we will continue to have those types of updates for the public. In fact, during today's committee meeting, we heard from our hospital providers, and I thought what was very interesting is that they have decided that they are going to enhance their measures when it comes to telemed, so that more people can have access to telemed. They are also going to set up hotlines that are for nurses to be able to answer calls for those who are concerned because they have some type of respiratory illness. So through these type of screenings through these hotlines, they'll be able to make the determination whether the person actually needs to come into a hospital or not, which could, at the end of the day, limit the amount of people who are coming into our ERs and hospitals. But at the end of the day, as the mayor said, it's really all hands on deck. We're all in this together. We're certainly going to get through this, but we do need everyone's cooperation and participation in heeding on the recommendations of the city and the state. I will say one last thing. I think across the country, we are very concerned about the economic impacts of COVID-19, and we certainly are here in the city of New Orleans. We're certainly concerned about the potential impact on jobs and whether there could be any job losses. And I would just say that us here in the city of New Orleans, along with all the other local municipalities that may face this, we must all lobby together to ensure that the federal government gives us the funding and the resources so that those individuals who suffer job losses due to COVID-19 are able to make ends meet at the end of the day. And I think we all need to stand together in that fight. So thank you.
Thank you so much, Council Member, and you are absolutely on target about the impacts in terms of jobs, but make no mistake about it, there will be an impact to the budget of the city of New Orleans. We know that. We know that our projections absolutely will be impacted, even as we're in the midst still of overcoming a cyber attack. These impacts are just real, and we're going to do everything necessary. I already started having conversations with our federal delegation about these financial burdens that it will place on the city of New Orleans as well as the state of Louisiana. With that, I want to ask Councilmember Palmer. You want to come on up?
Thank you, Mayor, and I just want to thank your entire team for the amount of work that's being done. And with that, though, it isn't just about government, it's also about personal responsibility. And I think that the number one thing that we can do as personal responsibility is be educated in a smart fashion. I cannot stress enough how the NOLAready.com in real time is very effective. We're using it consistently, and it's very helpful. And so I do stress that everybody use that continually. Also, though, with personal responsibility is professional responsibility. As we mentioned, this is a hospitality city. We have a lot of hourly wage workers. And we really need our employers and our managers to be responsible in their workplace setting and create policies and procedures in place that not only protect their employees, but allow their employees to stay home if they need so. And then also for us as a community to come together to ensure that these workers and our wage workers make sure that they have the resources that they need to get through this period. So again, that comes with a personal and professional responsibility. And going back to personal responsibility, please check. We all know, again, we've done this drill before with other types of emergency situations. But if we have neighbors that we know are older or vulnerable, do not want to go to the grocery store, we can all help them make some groceries. So again, I just want to thank y'all and thank you, Mayor, for your work.
No, thank you, Councilwoman. All right, and we're going to keep it going with our councilmen who are also joining us. So Councilman Williams, you want to go?
Thank you, Madam Mayor. You've heard from the governor, you've heard from the mayor. a century ago, there was a pandemic of influenza that struck cities of Philadelphia and the city of St. Louis. Philadelphia went on with their big events. They went on with their parades, and they had a large loss of life at that time. St. Louis went the route that the mayor has decided to go, that we need to go, that healthcare providers tell us to go, and it prevented loss of life. This is about behavioral changes to help our most vulnerable. This is it's a pandemic. We're going to get through this. The city of New Orleans has proven itself to be resilient through all things. Mayor, you made a tough call, but the tough calls that you made are going to save some lives, and that has to be paramount. As we focus on the FISC, I know Mr. Montoya, who's behind the mayor right now, has been looking at what this means for our budget for the upcoming years, because even after we get past this, there's going to be ripple effects on a tourism city, on a city that relies on people to use planes and come and stay in hotels. But we have to put public health above fiscal health, and we've got somebody right behind the mayor who's focused on that, and that is going to be very paramount as we move forward. City of New Orleans is not like Dallas or Atlanta, right? We're like Paris and Florence. We're a special, unique place. Changes have been made that are going to save some lives, but as Councilman Palmer just said, we've got to all change our behavior. And I'm the biggest offender of this. I kiss everybody I see. I hug everybody I see. And it is hard to turn that behavior around. We've been throwing beads into balloons, and now we got to put 6 feet between ourselves because we have a population of immunocompromised and elderly who could not make it through this. Most people in this room get this, you're going to be okay. There's a lot of people who will not be, and we have to think about them daily moving forward. We're going to get through this. We have to listen to the leadership of this city and the leadership of this state, and the calls they've made are going to save lives. Just realize that this inconvenience will save a life.
Thank you so much, Councilman. Points right on, as always. And I'm gonna call up Councilman Banks. Call him the closer.
He is a closer. It's a baritone.
Yes, it is true.
Thank you, Madam Mayor. This is an interesting position to be in, but it's not one that New Orleans has not been in before. We faced potential disasters before, and we've been successful in coming through them. This is no different. Some of the same methodologies you use to survive hurricanes, we need to be using here. Be very intentional on checking on your neighbors who do not have the ability, the resources that some do. Make sure that you are there checking on them to make sure that they have what they need. This thing is going to be serious, but it's something that we will definitely get through. Now, there's been a lot of noise made about the Super Sunday being canceled and the parade being canceled. But the reality of it is that there have been events around the world that have been canceled. The Cherry Blossom Festival in Japan, the rodeo going on in Houston is one of the biggest there is, South by Southwest. The View television show, filmed with no audience. The reason that that stuff is happening is because you need to have this social distancing to stop the spread of this disease. It's simple. Now, we will get through this, and at some point Super Sunday can roll and the parade can roll once we get past this. But right now, we have to make sure we do get past it. So do what you need to do. If you are feeling bad, stay home. Don't go out around folks if you have something that you know is not normal. If you're sniffing, coughing, you don't know what it is, stay at home. Make sure that you do not call 911 every time you sneeze. The reality of it is we do not want to clog the 911 system with false reports of anything. You've got to be intentional about that. We're all in this together. This disease has no racial boundary. It has no geographic boundary. It has no economic boundary. We are all facing the same jeopardy, but we all have the same salvation. And as we do what we need to do, we will get to this far. With that, thank you.
Thank you so much, Councilman. Thank you so much. So at this time, we'll go right on into questions Ms. LaTanya?
Madam Mayor, WWL.
With the state of emergency, you and Colin both kind of touched on it, but just can you be a little more precise about what the extra resources are that are coming to the city? Is it money as well, other personnel?
Well, it does open us up to additional financial resources at the state level. Also, of course, technical assistance as it relates to equipment even. And those are the things that we need, and not only at the state level, but it opens it up at that federal level. And we want to make sure that we are in a position to meet the needs of our people. And of course, this fluid situation that changes, it literally changes by the minute. Colin, anything to add?
No, ma'am, you covered.
Fox 8.
I just want to make sure we have the numbers confirmed of how many are in Orleans, and then additionally, not only is the city canceled, but outside agencies like the NCAA have changed their events in town. Your reaction to that?
They have. We did learn of the cancellation. Well, really, it's not a cancellation. It is, what is it, audience only? What is the right term? Spectator only. No spectators. So what that is, they say close family members and of course the teams that will be playing. And of course staff affiliated with those events. What we do need to also focus on are the fanfare. Is it the fanfare, Colin?
Yeah.
The fanfare, and I know something else at Waldenberg Park that we did not get confirmation on, but those are things that we will be following up on. One of the things that we do know is that the communication to our local host committee, that could have been improved, meaning there was very little communication there. So what we're working on is to ensure that communication is solid from this point forward as it relates to that event being hosted in the city of New Orleans.
And then just for confirmation of the number of cases.
The confirmation of the number of cases right now, we're at 9. Did we move to 10? We moved to 10?
There's 13 total in Louisiana.
Right, so we've now
I believe
moved.
10 are in Orleans, but again, we're awaiting final word.
Right. Well, we just got that number when the governor gave his press conference, and we have not had time to clarify that. But what we do believe, we've shifted from 9 to 10 in Orleans Parish. I don't have much of those details that I had like yesterday and the day before, because we did not allow for some time prior to the governor ending for us coming to you.
The Advocate.
Chief Health Department Director Jennifer Vegno, can you speak to how the contact tracing is going for Lambeth House, how testing is occurring for the residents there, and just kind of speak to them about and the families of those residents about how that's going?
Thank you so much, and she will answer that. And understand that contact tracing is something that we are focused on and advocating for in abundance. That is not just associated with Lambert House.
Thank you. Yes, they are, Lambeth House has communicated with the CDC and the State Health Department and us this morning, and are following all of the guidelines that CDC has asked them to do. Again, as you heard the mayor say, there will be additional CDC personnel. That's not just for Lambeth House, that's to assess or to assist in our entire efforts. They have been putting out messaging. I know that they are on the ground talking to patients, or talking to residents, talking to their families. They instituted their visitor guidelines very early on, and those are in place. We will be to date, the Louisiana Department of Health has been doing the bulk of contact tracing. We again are going to be assisting them starting tomorrow morning. That will free them up and allow us to be on the ground. So they're complying with everything, and I think are doing as good a job as they can under the circumstances.
Do you know if more tests have been administered to the residents of Lambeth House?
So we don't get information on any, what we would call a patient under investigation. That is someone who has had a test. So because as you can imagine that the numbers of those patients are increasing statewide, the state is not reporting directly to us how many patients are under investigation.
And as it relates to the contact tracing, and we are a very bottom-up, from the ground, community-focused administration. And so because of that, the need to improve the level of tracing is something that we're mandating. And mandating in such a way that we want to conduct training within our own city, within our own EOC, to do an even greater job as it relates to contact tracing. I indicated that to the governor this morning, that I really did want to see improvements there. As a result of that, we will get a greater level of technical assistance, as well as our advocacy to LDH, to CDC, and also the communication that I spoke to, making those requests to our congressional leaders. As a result of that, we will have 2 individuals flying here from CDC tomorrow, because it is a priority for us in Orleans Parish to do an even greater job with contact tracing. And you're coming from that community, and I'm talking to a lot of people, I know that we can do better, and we will.
WVSU followed by WWL and WGNO.
We have been told that some New Orleans firefighters have been asked not to report to work because of travel concerns. Can you explain to us what's going on?
Travel concerns? That doesn't seem to be accurate to me. As it relates to our firefighters, as well as some of our technicians with EMS. What we do know is that we had 7 of our people respond to and did a transport. That transport occurred without protective gear because it was prior to these things moving forward in terms of the call that was given to 911 wasn't very clear, meaning in terms of articulating the need in terms of what they were responding to. As a result of that, we responded without protective gear, and we have since put our people on quarantine, and also moving forward with testing that is necessary to ensure the safety of our firefighters and the safety of our EMTs.
Are they also responding to medical calls still? Are they still
The
responding?
individuals that have been placed on quarantine, no ma'am. Quarantine is just that. Take care of yourself, stay out of harm's way, and we care about you, and we're gonna make sure that you have the resources that you need. But of course, EMS is responding to those calls. I believe we moved forward with not allowing the fire department to respond to those calls. That was something that we changed up as of yesterday.
So EMS will respond?
EMS will continue to respond, and absolutely responding with their protective gear. And the fire department has been placed in a position to not respond.
The ones that are
Related to the quarantine.
WWL.
Dr. Avegno, are the cases all still presumptive positive at this point, or are any officially positive from the CDC?
I have not heard that any have been confirmed by the CDC yet. I can get that information for you. The majority, because the majority have come in the last 2 days, those are still presumptive positive. As you know, it's a couple of days turnaround from CDC.
I was going to ask too, I'm sorry.
No, we've mentioned this on yesterday that I'm not pleased, we're not pleased with not having the official results from CDC, but they are coming. We do know that.
I was going to ask too, has there been any outreach to the city's homeless population?
Absolutely.
Yes, absolutely. We've been in conversations with the shelter providers since last week. We have sort of a team from EMS and NOPD homeless liaisons with our team at the health department that have gone to the shelters today, that are increasing messaging in encampments, that are doing outreach and also bringing back shelter concerns and needs, and figuring out what we need to do to make sure we're giving them the support that they need.
And that also includes, you mentioned encampments, and that really does speak to our street homeless individuals. We do mass cleanings. I think yesterday was the most recent, and we will continue to assess the existing conditions and respond accordingly.
WGNO followed by USA Today.
So what exactly are those CDC officials that are coming in tomorrow, their responsibility?
Well, they're going to provide us with technical support that will be immediately aligned with and assigned to contact tracing. That's what we need right now. We really do. I want more of that. I want to drill down even deeper as it relates to our people who have been impacted and the contacts that they have made. And it's very important.
Can they confirm those cases that have gone to the CDC, or can they help you confirm any that are locally that may come
I
up?
don't believe that's the team that would be confirming.
USA Today.
Dr. Avegno, I understand from a press release yesterday from the State Health Department that the first patient on Monday was a community transmission. Is that correct? And are any other cases at this point presumed to be community transmissions?
So, again, we do not have any indication that first patient traveled.
Okay.
That would indicate community spread. If you heard the governor at his press conference, he announced that we believe that most of the cases are community spread. We do not have detailed travel histories on all of the cases from yesterday and today, obviously, but we are going on the assumption that the majority of these are community spread, or that we have community spread.
Right, and that speaks to the need to have effective and efficient contact tracing happening in the city of New Orleans at the level that we insist.
Will this affect any sort of, how people approach regular going out to restaurants, church, these kinds of daily life type of things?
Well, I mean, as we say, in terms of going to restaurants, there's no prohibition to that. Our businesses are still open. We definitely, want to go and patronize. We have employees who are working there, but it does speak to the public, the large events that we have canceled and will continue to assess.
WWNO.
Can you tell us
Okay,
more?
and the council, come on, Councilman, you said.
Well, I would just say a number of chefs and restaurants have improved their protocols as well in terms of how they are preparing food, washing hands, and the like. You look at social media, and you can see that there has been a behavioral change as described by Councilman Palmer and the mayor among the private sector and the public sector. Everybody realizes they have a part to play in this.
WWNO.
When were the EMS workers exposed to the coronavirus patient?
Well, this was associated with our first three that we unveiled a couple of days ago, Monday morning time, it goes early Monday morning. They were a part of the first three. There were two who were self-transported, and there was one that was transported by EMS.
All right, two more questions, WDSU followed by WWL.
Some businesses on Magazine Street are saying that they're concerned about the crowd control this weekend, being that there'll be a lot of pub crawls, even though, the events have been canceled. Is there any extra security that we'll have? Will we be more staffed in that area along Magazine Street?
Well, we have canceled, public permitted events that would free up our public safety team. And so we do not anticipate our police officer or public safety team members staffing unpermitted events. But we can do and will do extensive outreach to those businesses, and I would encourage them to contact the city to let us know that directly so that we can not only listen and hear their concerns, but do everything that we can to alleviate those concerns.
Last question, WWL.
I was going to ask, it's obviously, like you said, it's been fluid, changing minute by minute. I've seen some people asking already online, how long until we kind of get back to normal? You hear events being canceled, colleges, shutting down the on-campus learning. It gets kind of dystopian for people pretty quickly. So just your message to them, and again, it may be too early to even say how long until
Well,
we're
it
back
is,
to
and because we've grown from 3 to 13 in the state, but also as it relates to the contact tracing. That's something that has to be done to have adequate sense of how widespread this is. We did hear from the governor being alerted by LDH that we can officially say that there is community spread. One of the things that we do know, which our kids are so resilient, Lord have mercy, they are. And I'm just so glad that we have not seen any positives coming within our primary schools, K through 12. And what I do know, and I'm in full support of OPSB, New Orleans Public Schools, the Archdiocese, and our independent school community for not canceling school. And they will cancel once a positive result has been determined, and that will be with that particular school. So as of now, relative to NOPS, that is not the case. School will go on, and we know that in the city of New Orleans, it will create the impact, the disruption will be even greater when kids are out of school. Specifically for the majority of our kids, over 90% are on free reduced lunch. Many of our kids get the supportive services and the resources when they're in school, and less frequent when they're out of school. So we will continue to monitor this with our school community. Our universities, again, they're not closing, they're just on remote instruction. They have the capacity to do so. They're still open, but remote instruction is something that they're moving to on Monday. Yes, ma'am.
I just wanted to add the sort of the health perspective to this. And in public health, when you're looking at an epidemic, they generally tend to follow a bell curve, right? And what we call flattening the curve means that instead of having a very large spike of a lot of cases that stays very, very high and that top of that curve is very high, we wanted to get it as low and flat as possible. That happens when we all play a part, right? The way you flatten the curve is to prevent the spread. The way you prevent the spread is to do all the measures we've been talking about for weeks. So I don't know yet when our curve is going to start flattening, but that's really a community, a shared responsibility for all of us to do what we can do.
That's perfect.
Oh, perfect. Thank you, Dr. Avegno. So thank you so much again. We will keep you updated as we learn more. This continues to be a fluid situation. What I will reiterate correctly is to send COVID NOLA, right?
You got it.
COVID NOLA to 888-777. Did I get it right? All right. COVID NOLA to 888-777 for real-time alerts. So thank you again.